here with Dr. Michelle Bell. So excited today to be talking about parenting during the COVID crisis. And Michelle and I are, Dr. Bell and I are colleagues. We work on a variety of different projects. I'm going to allow her to introduce herself, and then we're going to dive right in terms of supporting parents through this video about how to, talk with your children, deal with homeschooling, manage work and life all in one space, which can turn into just one ongoing day that never ends. And also some tips on how to continue to create the new normal in terms of, parenting during COVID. So Dr. Bell, please introduce yourself.
Hi, good to see you again.
Nice to see you.
Feels like it's been a long time. So I'm Michelle Bell. I'm a licensed psychologist. I have a private practice in New York City, in Upper Manhattan, in the Inwood section. And my area of specialty is working with children and families. I utilize a family systems perspective. And predominantly when working with families, kind of using a structural approach, but also when working with adult clients, looking at family of origin, and of what do we bring from our families into our current relationships and life. So that's kind of the perspective that I use, the lens with which I look through. And apart from my private practice, I also, as you had mentioned, one of the things that we work on together is our work at the UN. So I'm also an APA rep at the UN, and my focus in terms of committee work is I work with the Committee on Migration, specifically the subcommittee for migrant and refugee children. So again, looking at the needs of children in our society and how psychology can best serve them.
Wow, you are one busy lady. So Michelle, I couldn't help but to think about, like, you are at the epicenter of this crisis right now. You're in New York City, you're in Manhattan. There's been these pictures floating around that were taken yesterday about people hovering over, I forgot what pier it was, on the west side, hundreds of people looking at the boats, the medical, ships come in.
Yeah.
And it just seems to me that some folks are still not processing the importance of social distancing. What are your thoughts about that? I mean, I love talking to native New Yorkers because, one, we're hard-headed from that perspective too. But then at the same time, we want to kill one another for being like really, you're going to just continue. You're seeing it in subways, people jamming into subways, still in parks and the streets. Governor Cuomo continuing to place barriers. What are your thoughts about that?
Yeah. Well, I think up in our little corner of Manhattan Island, it's not as crowded as some other areas, and so I don't see that so much happening here, but I do see it up on the news. And I think it's tough when one is used to living and existing in a city where everyone is literally on top of each other. 6 inches can feel like a lot sometimes, right? So I think it can maybe sometimes be hard for people to really internalize and get out of their habits, and really kind of internalize what these new rules are, and the social etiquette is.
And what do you tell parents who are like, I've been stuck in my house? Sometimes, if you're in the city and you're living in an apartment, which apartment living is the norm, right? And you're in a 800-foot apartment, 800 feet apart, square feet apartment, and you've got 2 kids, and sometimes more kids, or sometimes you're living with extended family members, depending on what your family composition is like. And you're going stir crazy. you know, your kids are going stir crazy. What are your thoughts about that?
Yeah,
You know, what do you recommend? What do you,
Sure. Yeah, it's tough, right? Because within that tiny space, we're not just having, you know, we're not all in the same space at the same time, but we all are trying to get different things done. And a lot of us are having to multitask. So we're working from home. Yeah. If we've been lucky enough to be able to transfer our job to home. And also trying to get the kids, if you have kids, get them through their school day, right? So taking the role of teacher as well as parent, as well as worker, as well as partner, or maybe even caretaker for elderly family members that are living with you. So it is tough. It's very hard. And I think one of my main recommendations is really around routine.
Tell us about that. What do you mean by routine?
So routine, can we mimic our regular schedule as closely as possible, right? So that doesn't mean that it looks the exact same, but how can we almost trick our brain and our body into thinking that things are going a little bit more normally? So that then will help us keep our energy up, help us keep our mood up, our anxiety down. And when mood is up and anxiety is down, our interpersonal relationships go a lot more smoothly.
Oh, wow. That's so, I love that recommendation because, of course, you know, I'm like watching Netflix till like 2:30 in the morning. And then I wonder why I'm like, oh my God, I got to get up. Because I still got to work, right?
Exactly.
And so being at home, it's like, of course I want to watch Netflix, like, you know, but that's hard. And
it is. It is, and it requires, I think, really concerted effort and a conscious effort to maintain that routine. And it's even the littlest of things, like getting up in the morning at a regular time, so that way you have your day and go to bed at a regular time. But get up in the morning, get out of your pajamas. Right? Sure. Don't stay in your pajamas all day. I know, right?
I will show you my bottom half. I promise.
I know it's hard because we're like, oh, I don't have to rush out the door, right? I have my cafe. I'm gonna, you know, have my pan tostado and drink and my coffee and have a relaxed morning. You can be more relaxed. That's fine, right? It doesn't have to be, you know, so rushed like we would be on a day that we're commuting into the office or getting the kids to school on time. But make sure that in the morning you get out of your pajamas. You know, it could be something very relaxed and comfortable, but change your clothes, you know, get into some clothes, take a walk outside. The same way you would commute to school or commute to work, get up, take a walk around the block. Tiny little things like that enable us to maintain a certain level of energy and a rhythm that keep us in a better space, kind of physically, emotionally, and mentally. So looking at those small details and finding ways to either mimic them or replace them.
Have you noticed a rise in like conflict and arguments? I know that like in my house, I have a young adult son, right? And he's 22 and he lives in Boston, but came to stay with us during the time of social distancing before things got really bad. And he has the capacity to work from home, so he's very fortunate from that perspective. But he's like, oh, I want to go to a friend's house. And I'm like, oh, absolutely not. You will not go to a friend's house, right? And so we're having these different like levels of conflict because he's like, I'm a grown man. I live on my own. What are you talking about? I can't go to my friend's house. Like, you know, and I'm like, over, you know, as I'm looking up at him, because he's like 6'3", over my dead body, you'll go out, you know? And so, you know, we're trying to manage that new kind of relationship, but that's hard.
It is. And particularly and it's not just happening, I think, between parents and kids, but even amongst partners, spouses, you know, this idea of people have different perspectives of what's necessary and reasonable. Right. And so I think communicating around, this is my perspective, this is how I feel when you behave in this way. I feel like using kind of your basic I statements, right? So it's not an attacking, it's not we're going to argue who's right or who's wrong, because nobody knows, right? They're changing the news every day. One minute they're saying you only have to wear a mask if you're sick, and now they're talking about maybe everybody should wear masks, and evidence shows that that actually can help, but the evidence that they look at changes every day. So I think the idea is coming from a place of, let me explain how I'm feeling about this situation. Let me hear how you're feeling about the situation. Can we find a happy medium, a way that we can all feel comfortable? Can we just communicate and hear each other? And also then having that communication enables us to empathize with the other. Right? Instead of needing to be proving a point or being right. It's, well, let's hear each other. And so if I can hear that you're really frustrated, well, let's problem solve about ways that you can hang out with your friends, and let's set up a time for you to do a hangout where you can have the room and the computer all to yourself for an hour and nobody's going to bother you.
That's great negotiating. I love that.
Right. Like, so this idea of, if we can hear each other, then we can problem solve together instead of against each other. Right. So
now, how do you advise for families who already were coming from pretty dysfunctional situations? And I hate that word dysfunctional, because I think that every family dynamic, struggles, some more than others, right? But where they weren't having open communication, and the busyness of life, kids going to school, parents going to work, or being out of the house in one way or another, didn't allow for true communication to happen. So they've never developed a reasonable way to communicate with one another, and now they're homebound. Everybody's homebound.
Yeah.
How do you manage that?
Yeah, I think that's difficult, right? Because you're trying to deal with a situation where there may be even more stress. But for some people, it may actually be less stress, right? In some ways. I don't have to deal with the trains. I don't have to deal with everyone in my face all the time, strangers in my face all the time. Right. So for some people, this is actually, they may be feeling a little more relaxed. For other people, they now don't have a job, and so they don't know what they're going to do, right? So I think one thing is, getting information. Call 311 in New York City, right? Call 311, get information. What recourse do I have if I can't pay my rent or I can't pay my mortgage? What's out there? So that's number one. And then in terms of the communication, sometimes if we don't have the skills, connecting with a professional. A lot of professionals are providing services and webinars, and they sit down and watch a webinar or a video, or engage in a couple of therapy sessions if you have insurance. Or there are also a lot of therapists are providing some resources free.
And I know that New York City has a whole initiative around volunteer therapists. Exactly. It seems like Governor Cuomo was able to gather about 6,000 therapists, ranging from different types of specialty, to volunteer some of their time. I know in Connecticut, Governor Lamont is doing the same thing. So I love your idea that if the conflict is getting beyond what you as a parent feel that you can resolve, getting that professional support, somebody objective, somebody that doesn't have a stake either way, but that can help you navigate through these times, that's a phenomenal recommendation in terms of the way. And not to be ashamed, porque, and I'm going to switch into Spanish, en la comunidad de nosotros, in our communities, we have a really difficult time with the stigma of mental health. Exactly. Like, this is a crisis. And it's okay in a crisis for you to seek some support on helping you get through this emotionally, mentally, physically, all that comes along with
Exacto,
that.
exacto. Si uno tuviera diabetes, iría al doctor, al médico, a pedir ayuda, consejo y estrategias para manejarlo, ¿no?
That's
Así
right.
igual. Entonces, so it's like having diabetes, right? If you get diabetes, you ask your doctor for guidance, advice, and strategies. So it's the same thing.
It's the same
You're
thing.
exactly right. It's not something. There is a lot of stigma around it still, unfortunately.
Yeah.
But I can say I think there genuinely really is nothing to be ashamed of. It is something that we're all going through, and we all need supports.
Right. No
and,
matter
and,
no
and
matter
extra
what.
help.
Yeah. You
Definitely.
mentioned your work with my at the UN with the Migration Committee, and I would love for you to spend a couple of minutes talking about parents that are dealing with this border crisis as well. And I know that some of your work has been focused on providing therapeutic support, and helping shape what this is going to look like in terms of psychology's impact to migration and to the immigration, crisis. What would you say to families that are currently in those border states, dealing with the pressure of being in a detention center, being separated from their children, not knowing where they are or how they're being cared for? What kind of advice do you have, for those parents and for so many people that perhaps want to help and don't know how?
Yeah. So, excellent question. I mean, I think, and this is something that we've been struggling with for years now, even before the COVID-19, the current pandemic, the current crisis. So this is just adding another layer of complication. And, in terms of recommendations, if you are if you are a family that has been separated, there are a number, for example, apart from my work with the UN, I'm also connected here with a community action group, a local action group that assists families who've been separated or are in sanctuary. And so reaching out to members in your community, seeking out some resources. There are a lot of people who are working really hard to assist families, to enable them, one, to connect to services that they need, legal, medical, housing, and also, if possible, if you are lucky enough to have some information about where your child may be, or if you're a kid listening to this, if you have any information about where your parent may be, and you do have a means to try to, either through a lawyer or someone, have communication. So if you have an appointment or your child has an appointment, and you can take advantage and coordinate and have time to talk on the phone, do a video chat, take advantage of any moment you have, even though in the moment it feels hard and there will be tears. Maintaining that connection is so important. And it's criminal. It's a tragedy what's happening.
Yeah.
In our country, and I never thought that this would be happening in our country, but it is, unfortunately. And
and as these cases increase, and we have now surpassed Italy and China, respectively, in terms of COVID cases, the most vulnerable families become even more vulnerable.
Exactly. And I think that's something that we need to remember. And I think it's, I was going to say a little bit earlier, this idea of look for the helpers, is something Mr. Rogers is very true. And I think we all need to do that. And when we are in a position where we can stand up and be a helper, do it for in small, tiny ways, even if it's drawing a picture and hanging it on the fence of your local hospital to say thank you to the healthcare workers.
Yeah.
That's something that as a family, or even as an individual adult, things that we can do that not only help others, but even and help ourselves, right? You see,
Absolutely.
our own sense of well-being increases if we have a sense of agency, if we have a sense that we can do something,
right,
as small as it may be, we can do something. So take advantage of those moments, get creative. Think about ways to do that.
It does require a lot of creativity right now in terms of how to remain connected,
It does. And I was also going to say, in terms of tips of everyone being, when the family is together, when everyone is on top of each other at home, have fun time.
Yeah.
Like, make a conscious effort. People aren't getting out and socializing, right? So pull out the board games, set up a puzzle on the coffee table, or on the floor. If you don't have a coffee table, you don't need one. I've been recommending everyone get a hula hoop and a jump rope.
I love that. You're doing a retro, taking it back.
Oh, yeah, I know, right? But let me tell you, those are like the best ways to exercise in an apartment. You can slide it under a bed in a corner, roll it up, stick it away. Doesn't take up a lot of space, but you can really get your heart pumping. And it's fun, and people feel silly. And if you can laugh, feel silly, play charades, put on a good salsa, some Grupo Nietzsche.
That's right.
And go for it.
And get it going.
Right. And dance. Or a good disco, some Bee Gees. Take it down any road you want, but just dance.
Right. So Dr. Michelle Bell, giving us parenting tips. I'm going to go through a couple of ones that I definitely heard and want to highlight, and then she's going to close up with telling us about her workshop that she's going to have this coming week. Number one, create a routine. Make sure that you try to set a wake time and a sleep time, so that way you keep up in that routine and normalize what your day is going to look like, even if you're not leaving the house, but you're still working and going to school. Take a walk in the morning, maybe to mimic what it would have been to look like your commute to work, or in the afternoon, coming home from school, or coming back from work, but taking a walk, taking a deep breath, making sure you're practicing social distancing. Identify what's necessary and reasonable, and not have like expectations that are going to lead to disappointment, but instead making sure that you're clear on, okay, what's necessary right now, right? Do I need 600 rolls of toilet paper, or am I going to be okay with just a Costco's bag full of toilet paper, right? So setting those what's necessary. I love that. Necessary and reasonable were your words. Sharing your perspective so that to reduce conflict, making sure that you're using I statements when you're sharing your perspective so that you can negotiate what would be the best solution. Because after all, you are stuck in the house. There's nowhere to run. So you might as well start figuring out a way to engage in productive conflict. And the last one, but the one that I think is the most important one, is fun time. Bring out the kid in you, whether that's with a hula hoop and a jump rope, or with some music, or with laughter, or movie time, or creating puzzles together, playing charades, whatever you need to create some fun time with your family. Introduce that as a daily habit so that it doesn't seem all so heavy. Dr. Bell, we appreciate these parenting tips. We want to hear about your workshop, your webinar that you're having this week. Can you tell us about when, where, how do we access that?
Sure. So I'm offering a free little It's a psychoeducational seminar on parenting during COVID-19, tips for staying healthy for the whole family. I'm going to be doing it through the platform Zoom, and it's this Thursday, April 2nd, and it starts at 6:30, and it'll run for about 45 minutes. I'll be talking about some of the tips that we talked about today, as well as a couple of others, some other activities and routines and resources that are helpful to decrease stress and improve mood.
I love that.
So if you're interested in participating, you can email me at inwoodfamilyguidance@gmail.com.
And we'll put that in so that you guys see that, inwoodfamilyguidance@gmail.com.
Yeah.
This Thursday, April 2nd at 6:30 p.m. through Zoom. So you'll need a link to get into the parenting tips in the time of COVID seminar held by Dr. Bell. Thank you, Dr. Bell. You are amazing. These were fantastic tips. I wrote these tips down because I'm like, I need to follow this myself. You know, sometimes you can't be the parent and the coach at the same time.
Yeah.
And even myself as a psychologist need to be reminded of the things that will make this time easier and more productive for my family. So I really appreciate your time sharing your knowledge with us, and I look forward to hearing your seminar. I'm going to try to see if I can join myself, and if not, at least share with my community.
That would be wonderful. Thank you. I appreciate it. Yes, we all need reminders all the time.
Thank you,
myself included.
Absolutely.